At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Low Back Pain on Wednesday, August 14th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. That's rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome to Dr. Tom Roselle Live, and it's another decent, very lovely day outside and Sunday in the Washington metropolitan area. Get out and enjoy it. We have a world in turmoil, but we're not going to touch that today. We're actually going to talk about, other things that cause you to be irritated. And today we're going to talk about your hips and why they're not flexible and you can't twist and turn. You can't stretch your legs out. And it, leads to all kinds of things, including hip replacement time, or you're going to have to do some other silly things that you may not want to do. But we'll talk about the why behind that. Before I have to share something with you before we get into that. So I'm broadcasting today via modern technology from my office at the Roselle Center in Fairfax, but they have me confined, isolated to my back office with the door closed. Why? Because we're having a Women's Day. So the Roselle Center has opened its doors between 11 and 3 o'clock today as an open house for all of you lovely, lovely ladies. And we're going to be doing flower essences, and there's going to be some beautiful hand-done cards, and there's going to be thermography, and there's going to be some acupuncture conversations, and there's going to be herbal conversations, and just a huge amount of flowers everywhere. It's just a beautiful, beautiful display. And so I get a call this morning, and they said, why don't you come in and help us out and do the program from here? I said, sure, not a problem. And they said, but you can't stay. Help us and leave. I said, what? And they said, okay, fine. Really? You're isolating me? So it just goes to show that my office is definitely not woke. And I can't say that I want to be, Thomasina today. And doesn't work. They just look at me and said, I think you better go have some breakfast someplace. Anyway, I'm here with you and I'm hiding. So, but, we're going to go from here to the live stream immediately after our program here on WMAL 105.9 FM. And remember how you do that? You can do it on any of our social media platforms. You can go to Facebook. You can go to Instagram, you can go to anything that you may have. And if you follow us, they're going to let you know we're ready to go. But if you don't have that, then go to drtomroselle.com and click the button, because as soon as you go up on Sunday, the thing will be there, and boom, you hit it, you go in, and then you get to watch me. And I got a really, really nice flower shirt on. And, I thought I'd be kind of with the party today, but they said, no, you should have just worn jeans and a sweatshirt, and you go back and do your program and just, stay out of our way. I said, okay, fine. Let's talk about your hips. Let's talk about, the things that make you not want to walk very far. But there's a lot of reasons why your hips begin to hurt, and some of them you may not even think about. Now, let's start with the obvious. The hips can be directly impacted simply because of the fact that you got way too much weight on them. Your pelvis is out of position. The postural pattern is a wear and tear. You have a short leg on one side, and it's like tilting the house, and things begin to wear down. So pretty soon the cartilage, breaks down and that sort of thing. And you've tried everything and it's not working. Well, now you go to the doc and you said, well, you have this and that and the other thing. But you can get hairline fractures too that you're not even aware of. And most of them occur in people that, you're over 50. And these fractures occur in the upper part of the bone as it comes near the pelvis. And a hip fracture, if you will, in the upper part of the long bone. It's called the femur, by the way. That long bone that goes into your pelvis is called a femur. It can happen because of a fall or an accident. And if it gets really bad, you can just be walking and all of a sudden it breaks and you fall. It's not the other way around. It's not you fall and you break it and you fall. And that's because your bone density, and we're going to be talking about that more extensively a little bit next week, and as we haven't touched in the past, the bone density is compromised because of arthritis and osteoporosis and cancer and so forth. So, but those are the guys that really get you at the end, but in the beginning, you have to figure out why. If you don't have good lateral motion, you can have what's called a labral tear. And that's deep into the socket. Feels like it's in your groin or radiates back into your buttocks. And the pain can be very dull or sharp. It's usually worse with any kind of activity and weight bearing. When you try to straighten your leg, it doesn't feel very good. And even in a sitting position, you may feel stiffness when you move your hip. There's no lateral ability, or you can hear the click and pop in that deep groin area in your hip. So, we're not talking about athletes here. We're just talking about you and me. We're talking about, what can happen over a period of time. And we're going to get into a little bit of what causes that. If you join me on the live stream, I've got a skeleton in front of me. I'm going to show you what really takes place. But the most common form of arthritic problems is called osteoarthritis. That just simply means you got degeneration of a joint space, and it's the biggest cause of disability in people as we get older. It's what happens when the joint, the cartilage begins to wear down. Now, what can cause that? You've heard me talk about this repetitively, that viruses of all sort, but particularly Epstein-Barr and cytomegalovirus and so forth, like to live in joint spaces. And then all of a sudden they get activated because of a fall, because of a blow, because of a trauma. But the osteoarthritic condition that is progressive, if we don't do something about it, it can be reversed if you catch this thing at the right time, but it can affect all kinds of joints, not just the hip we're talking about, but your knees and your elbows and your shoulders and the like. And these are all the joints have these little sacs with synovial fluid. It's kind of the liquid that allows it to glide easily, if you will. But ongoing pain and stiffness in your hip can be the thing that says, hey, pay attention here. You got a problem. And sometimes we don't. We can strain it. We can go too far. We can, think that we're a kid and do a ballet stretch, but not so much, right? So we can get a tendinitis opposed to a bursitis. I'm going to give you the differential right now. A tendinitis means that it hurts when you move it. A bursitis means that it hurts when anybody moves it. So if you're lying on the table, the doc takes your leg and you feel pain in the joint space, or you move it and you feel pain, it hurts either way. That is a bursitis tendinitis. If it only hurts when somebody else moves it, then, you're looking maybe at bursitis. But if you move it, no matter what, that's a tendinitis. You've irritated the tendon insertion. Tendon is what attaches the muscle to the bone. And if that thing is overtorn, overstrained, is a problem. And if it tears at some point, you're looking at surgery. But there's a lot of things that you can do before that. And that's what we want to talk about. Coming up in the next couple of weeks, I think it's Wednesday the 14th here at the Roselle Center for Healing in Fairfax. I'm going to be doing an in-house program with Dr. Harlan Browning. We're going to be talking about your low back, but also your hips, because you can't talk about one without the other. And so we have to make sure you get it. And at many of that, you've heard Dr. Browning. He's amazing. He's brilliant. And he'll give you more information and usable stuff, things that you can put together. So make sure you register for that program. All you have to do is go online at drtomroselle.com or simply rosellecare.com, old-fashioned way, 703-698-7117. But let's talk a little bit. I'm going to tell you a couple things that you wouldn't have thought about. And let's talk about that kind of far-reaching one that people say, what? How did that happen? When you go to the dentist and the dentist has your mouth open for a long period of time, you feel this awfulness in the back of the hinge of your jaw, where it opens and closes. There's a muscle in there. It's called the pterygoid. It's spelled P-T-E-R, pterygoid muscle. And that muscle is a hinge muscle. It opens and closes. But do you know that if it gets too tight, it goes into spasm? Because either your bite's off-centered or your mouth's been open too long. We won't go there. There's some people that I could kind of finger point that with. But nevertheless, if that muscle gets too tight, your hip abduction, your ability to move your leg away from your pelvis, is no longer free-flowing as it should. And guess what happens? You start having pain and you start getting degeneration. So dental work that is causing muscle imbalance within the jaw of your mouth can cause the muscles in your hips to stay too tight, so you can't move them outside, laterally abducting them from your pelvis. Sounds strange, doesn't it? But that's what really happens. And I see so many patients with degenerative disease, and it's compounded by lots of other things that are initiated, if you will, because of some dental work that they had even 20 years ago, 25 years ago. And they've tried to keep themselves in good shape, and they do the best they can to stretch it out, but it doesn't work because they're stretching in the wrong place. So when you come in on the 14th, did we say, of August, as you're used to coming into the Roselle Center in Fairfax, we're going to talk about that. I'm going to show you exactly what happens. I may even demonstrate it on somebody and release it and show you, oh my gosh, this really happens. I don't have to be a patient that I know something about, but I'll show it to you. So here's the other piece. How many of you have had steroid injections in your hip, in your shoulder, in your low back? Well, years ago, the medical community maintained its position that injecting steroid was not a big deal. And they say once the steroid takes effect, you'll notice the pain, wears off over a period of time, slowly it's not there anymore. If they put it in your back and your spine, it's called a depomedrol injection, but they like to inject joints that way. And then even in the professional leagues where they used to inject the joint to get rid of the pain, get rid of the swelling, they stop doing it on an ongoing basis. Why? Because it begins to degenerate the joint and make things much worse. There was an article that was published at Harvard, right? And the doctor that published it was Robert H. Schimmerling. He's a medical physician. He's senior faculty editor for Harvard Health Publishing. And the article was a new look at steroid injections for knee and hip arthritis. And they talked about, the arthritis and using the NSAIDs and so forth and so on. And what they said is that about 8% of people getting steroid injections seem to worsen after the injection, far beyond the expected rate of acceleration. And then unusual fractures may occur in a little over 1% of the people that get that injection, and that there's significant bone damage, something called osteonecrosis. That means bone dying in about another little more than 1% of the people. So now you start adding that up and the compounded injuries. And the other thing that they began to notice is the wear and tear degeneration of the cartilage. So guess what happens when your doc says, well, let's inject it and let's see what happens. I don't know about you, but knowing what I've known, and actually what I've told patients about for years, for decades, is that you have to be extremely careful in doing that. Unless it's an acute injury, something that happens right now, and it's one and done, and you don't go back to it again, instead of every 3-4 months, and then it compounds it. Those numbers I just told you are the first injection patterns. What happens when you start adding to that, one on top of the other, on top of the other, on top of the other? It would seem to me that you're risking, you're rolling the dice on this thing. There's another article that came out, the Radiological Society of North America, and talked about hip degeneration due to this problem with steroid injections. This was a study that was led by a guy by the name Guzamazi. He's a MD, PhD, professor of radiology medicine at Boston University School of Medicine. And he found that corticosteroid injections associated with complications that potentially accelerate the destruction of the joint and may hasten the need for total hip replacement. And I'm reading directly from the report, by the way. So please be aware that when you do that, you can end up in worse problems than you already have. Not something that's, I think is worth rolling the dice on it. But there's ways to find out what's going on, and you have to really look at it from a real life situation. So if we have inability to move the hip laterally, we're already getting wear and tear in the outer portion of the hip. And try this: lay on your side, see if you can lift your leg up without it hurting. If you can't, that's a sign that says you may have some problems. And you need to begin to stretch that out. Begin to move that hip on a regular basis. But again, it may be coming from your mouth. How about the weight that you got on there? What does it take you to get out of a chair? If your butt muscles aren't strong, if your belly muscles aren't strong, if your back muscles aren't strong, you have a tremendous amount of wear and tear. Take a look at your shoes. Pick your shoes up, your running shoes, your walking shoes, your sneaker shoes, your working shoes, and see if the heels are wearing down equally, or if you have one side of the heel that is really wearing heavily. That's telling you a couple things. One, the pelvis and the rest of your spine is out of position, putting more weight, pushing back on that side, or you have a leg length inequality, or the muscles that are supportive all the way through are not doing their job. And now in my world, we're going to look all the way up the spine, all the way up to your occiput, your head, that big old bowling ball you got sitting on your shoulders. There's 22 bones that make up that noggin. And it's supposed to move freely on top of your neck, called the cervical spine. If it can't do that, then the lower muscles, particularly muscles called the iliopsoas muscles, they come from the spine and they attach directly to your hips, aren't going to work the way they're supposed to. So postural imbalance is a major, major contributor to this type of situation. Then we get into the muscles that attach, the iliotibial band coming off the hip and going down the side of the leg, the hamstrings attached to the back of the pelvis and go all the way down, the thigh muscle, the quadriceps. If those muscles are not working as they should because either the nerve in your back is being pinched, irritated, stretched, or that the muscle organ relationship, and the ones I just talked to you about, particularly the iliotibial band and the hamstrings and the thigh muscles, they're all intestinal tract muscles. So if you're eating a lot of garbage, as they say, and you're putting it down inside of you, you have inflammation, and those inflammatory reactions now cause you to have more problematic potential than somebody else who doesn't. So, we really got to take this thing seriously. We have to understand that throwing an NSAID, a non-steroidal anti-inflammatory like naproxen or ibuprofen or Advil or Tylenol or any of those things, they may reduce the inflammation and the pain, but they can cause increased damage over time. Why, you might ask? Simply because it competes with the absorption of sulfate ion into the joint that repairs the cartilage. What do I mean by that? Well, you've heard the term chondroitin sulfate. And so that's the cartilage, the biopeptide that your body makes to try to transport into that cartilage to try to fix it. Unfortunately, if we're taking the NSAID, guess what happens? It competes for that receptor, and the body doesn't do a good job anymore. Now, if you've ever had surgery on that hip, for any reason, particularly back in the old days, they found that people who had surgery ended up with increased problems over a period of time. So what you have to do is you got to find out what the triggers are here and why we're having so many problems. How can we turn this off? Well, first thing to do, get clean with what you look like in the mirror. If you got a lot of extra stuff hanging around, maybe it's time that you really get serious about living properly and not putting the things in your body that you should. How many of you like to go, so I don't eat wheat, but how many of you eat corn all the time? You're eating your chips, you're eating all kinds of things. Do you know what they do with farm-raised animals to fatten them up the last 30 days? They corn feed them. And that puts the weight on. Well, it's putting it on you as well. So if you got a bad habit with eating corn chips, corn this, corn that, take a look at the labels too, because a lot of things have corn in them that you wouldn't think they do otherwise. They're great gluten substitutions because it's not gluten, so they put that in there. But the telltale sign is that your body is showing the end product. So I take a really good look at you. That's number one. Number two, what do your shoes look like? Ladies, I promise you, if you're wearing heels, and it throws your pelvis forward and you go backwards, guess what's going to happen? You're going to put more pressure on the hip. You're going to get an overstretch of the muscle. And it's going to hurt. Your legs are going to hurt. Your butt's going to hurt. Your back's going to hurt. And then pretty soon, you have tremendous imbalance that takes place. And now you can't even stretch it out anymore. So you have to make sure that the muscles are working properly. If your hormones are down around your toenails, for a lot of reasons and things that we deal with on an ongoing basis at the Roselle Center, if your hormones aren't working, then the adductors, the muscles that bring your legs together, cannot work. So subsequently, you're going to get imbalance in that system. We're coming up to that part of the program where I got to say, don't go away. Meet me on Dr. Tom Roselle live stream, or Ageless Health live stream, as we like to call it. And we're going to continue this process and talk to you a little bit more about it. I'll see you in a few minutes. Remember, I do this simply because I love you all. See you in a couple.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Low Back Pain on Wednesday, August 14th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. That's rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.